Hello, everyone, and thank you for joining us. My name is Jennifer Larson, and I am the training coordinator for the Office of Community Living. And we'll just go through a couple of housekeeping items real quick. Just a reminder that we are recording today's session with the intent of posting this on our website. So please be cognizant of sharing any personal or protected health information, either verbally or in the chat. Our team will be managing questions in the chat panel, so please type those in as you have them. A copy of today's slides are available on our website, and I will put a link in the chat for you right now that will help you be able to go there and copy down or grab a copy of those slides. If you are listening by phone only and not in the video portion of the meeting, you can still participate by pressing *6 to mute and unmute your phone, or press *9 to raise and lower your hand to be added to the queue. And Zoom does provide closed captioning, so you can turn that on or off by clicking the live transcript button or the CC button at the bottom of your screen. And with that, I will turn it over to Haley to start us off.
Thank you, Jen. Good afternoon, everyone. Thank you so much for being here with us today. Today, we will be covering the American Rescue Plan Act Home and Community-Based Services update. Our focus today is on providing key updates to our providers. And we'll be covering quite a bit over the next hour and a half. So again, appreciate you all being with us today. Next slide. So a quick overview of our agenda for today, and I think I forgot to introduce myself. I'm Haley Gleason, the Strategic Outcomes Division Director within the Office of Community Living, and I will be starting us off by giving a couple of general ARPA updates. Then we'll be moving into some key project highlights. We have a number of different staff members, as you can see here, who will be joining us from across the department to talk about some of our key priority projects that are underway with funding through our ARPA HCBS spending plan. Then we'll move on and talk a little bit about some grant opportunities that are currently open. We have a number of grants that have already been open and since closed, but we have 2 that are currently live, and we want to make sure that you all are aware of those. And then we'll close out with just a couple of other office updates before 5 p.m. today. All right, next slide. Next slide, Jen. So like I said, I am going to kick us off with some general ARPA HCBS updates. And I'm sure everyone is wondering about the money. So that's where we're going to begin. So we wanted to give you an update on where we are in terms of our ARPA HCBS budget. So I'm going to draw your attention to that second column, which says fiscal year 2021-2022 budget. So those are actually our expenditures from the last fiscal year, which ended June 30th of 2022. So you can see that in that first fiscal year of spending, we spent about $86 million of our total budget, which is around $530 million. The next column shows the current fiscal year that we are in right now. So fiscal year 22-23, our budget for this year is the largest of any of our fiscal years, sitting at about $296 million. And then from there, you can see we sort of taper off as we move into fiscal year 23-24 at $122 million, and then fiscal year 24-25, which is really our closeout year, we'll only have half of that fiscal year where we have $3 million. Next slide, please. So now I'll dig in a little bit more into our current fiscal year spending and budget. So again, you can see in that second column, we have our total fiscal year budget, which is $296 million. Budgeted through October of 2022. So that is what we're showing here in terms of spending is through October. We anticipated spending about 80 million, and we're just a little off from there, but pretty close. We have spent through October about 73 million. So you can see that our spending is significantly ramping up from last fiscal year. And we anticipate that that is going to increase exponentially as we continue in this fiscal year, particularly as we begin to get our grant agreements signed and start to really push that money out into the communities in support of those grant projects. Next slide, please. All right, and you probably noticed on that first budget slide that we've included fiscal year 24-25. And so this is just a reminder in terms of our timeline update. Previously, our end date for this spending was March 2024. That was the deadline that CMS had given us for spending all of these funds. But in June, they announced that they were extending that deadline by 1 year through March 2025. At the department, we took that information and really considered all of the options for what that meant across all of our programs, and understanding that we really, we want to get this money out to our providers, to our community members, our workers, our community-based organizations. We want to get that money out quickly. And so we will be leveraging that extension, but only through December 2024. So that is our new end date, is December of 2024. We did take the approach that we are allowing projects to extend to December 2024 on a project by project basis. It wasn't just a blanket change for all projects. Again, with that intention that we really want that money to get out soon. And so if able, we wanted projects to continue on their original plan. But since that time, we have had 27 projects that we have reviewed and approved to extend to that December 2024 end date. And some of the reasons for that is really just looking at ensuring success of the project, giving a bit more time. Grants is a good example of allowing our grantees to spend the money. And so we really took all of that into consideration when we were examining these projects and decided that those 27 at this point are the ones that really should be able to and will benefit from leveraging that longer time frame. Next slide, please. So those were just a couple of quick updates, general ARPA HCBS updates to get us going. I want to pause now and see if anybody has any questions. As a reminder, you can either put your questions into the chat. We do have staff members that are responding sort of immediately to those in the chat, but we also will have opportunities for questions and discussions live. So if you want, you can either raise your hand and we can unmute you and you can ask your question. If you're on the phone, you can press *6 to unmute yourself, and you can also ask a question that way. All right, not seeing any questions yet, so I will keep us moving. Next slide, please. So like I said at the beginning, we have a number of really exciting projects that we wanted to provide updates for you about. So I will now pass it over to Emily Holcomb, who is our Behavioral Health Crisis Response Policy Advisor within the Office of Behavioral Health Initiatives and Coverage. Take it away, Emily.
Thanks, Haley. So I'm here to talk to you about how we are expanding crisis services in Colorado. Through the ARPA 2.02 initiative, we are adding to the crisis continuum by launching a new mobile crisis response Medicaid benefit, which is available to all Coloradans regardless of insurance status. This is being done in collaboration with the department and BHA, the Behavioral Health Administration, to design it and launch it. We've been working in stakeholdering over the last 11 months to design it and are beginning to complete it over the next month. Through this collaboration and launching the benefit, providers can receive enhanced federal match for the first 3 years to offset the cost of ramping up services. Some of the goals of why we're doing this are to improve service quality, to reduce unnecessary service utilization, to enhance client connections to community-based services, strengthen network capacity, especially for target populations, increase awareness and integration within the crisis system. I'll just keep going. So a quick overview of what mobile crisis response is. It is a 24/7, 365 service that occurs where a client is at in the community to offer relief and stabilization. People on these mobile crisis response teams are dispatched through 988, 911, the Colorado statewide crisis line, and some other methods as calls are received. Mobile crisis is delivered by a multidisciplinary mobile crisis response team with specialized crisis training and expertise set by federal requirements. These providers are required to coordinate follow-up services after the crisis to ensure continuity of care for that client. And it is not a replacement for ongoing mental health and substance use disorder treatment services. And it also doesn't replace what's already happening in Colorado. It is just another option in our continuum of services for communities to use, and is also an opportunity for greater collaboration across all crisis providers in Colorado. Next slide. So this is a look at the actual components of the benefit. This outlines key components and is to be used by these teams that are eligible for reimbursement for services to Medicaid members. So one of the key components is engagement with community partners. So making relationships in the community to ensure proper handoffs and understanding more about the benefit, and that partners know about both its purpose and know to refer to it, and if they might be a site of crisis response. Dispatch integration is a critical part of this. So providers and ASOs and RAIs will work together to work on dispatch issues and making sure that dispatch is made, the connection to these teams are made, and people are getting the right type of service. Mobile crisis response activities that happen in the response include a initial face-to-face risk assessment. Our requirement for that is shortening. It should be a shorter assessment in order to improve the client experience during the crisis and focus on the brief intervention, stabilization, and de-escalation activities. Providers will work with the client as well as any family, friends, people relevant to the situation on crisis and safety planning. Providers then also should work on follow-up activities, which are expected within a certain time frame after the crisis. So face-to-face or telephone response to coordinate with that client and make referrals to other health, social, and services and supports. These teams are also required to maintain relationships with community partners. So just continuing to make sure that they are connected in the community and other crisis services, and that they are working on sharing about this. So BHA will be working on marketing related to this and 988 and other crisis initiatives. And so part of this is that providers will work with BHA and other means to actually market this work. Staffing requirements include that teams should respond in a paired response. There's always going to be two people going out to the crisis, but some scenarios mean that one of them will show up via telehealth. So one person could be a peer, they could be a bachelor's level clinician, they could be a community paramedic, and then the other person on telehealth should be a licensed provider, and that should give more flexibility to when there are challenges around weather or distance or staffing. Like I was mentioning, team members are multidisciplinary, so they can include anyone from peers to master's level clinicians and everything in between and beyond, as long as they have the crisis professional credential, which will also be a part of the training requirements in this. The BHA is creating a learning management system, which will include existing training for behavioral health providers, but will be enhanced to have crisis-specific trainings that mobile crisis teams will need to participate in to have credentialing from the BHA as a mobile crisis team and support the people actually providing these services so that they're crisis-specific expertise. And it is, yes, 24/7, 365, available across the state, and responses in urban areas should be 1 hour, and in rural and frontier up to 2 hours. And the response needs to occur in a non-crisis setting, so somewhere that doesn't already offer crisis services, and that might be someone's home, a library, or some other location. And telehealth may be used in the crisis if there isn't a physical two-person response, but there should always be 2 people, and one could be in person or remote. And then telehealth can be used in the follow-up activities to connect with the client. And if needed, the mobile crisis teams can coordinate secure transportation or provide it, but that is not an explicit part of this service. It just is potentially a next step in a crisis response. Next slide. Here's a short timeline of what we've been up to. Starting in January, we initiated a crisis system assessment, just seeing what the landscape in Colorado looks like for crisis services. Initiated key stakeholder interviews in a work group to design the benefit. And then over the last several months, we've been doing virtual and in-person stakeholder engagement to get feedback on this benefit design. And now we are finalizing our product. Happy to share that. If you have feedback, we are still welcoming all of that feedback. And we will be moving into state plan amendment, updating contracts, and then the Behavioral Health Administration will be administering a needs assessment administered through administrative services organizations. Can't get away from administrative. So they will be sending that out for providers to assess where they are at in ability to meet the new benefit requirements. And then we plan to launch in July 2023. So more info to come. And on the next slide, we have information about upcoming opportunities. You can reach out to me to hear about our weekly technical assistance meetings. So we are launching ones that are for members, for providers, for administrative service organizations and RAIs, as well as a general meeting. If you want to attend any of those, you are welcome. So you can email me, and information will be posted online. And again, that needs assessment will be coming. So yeah, happy to answer questions and share previous slides and recordings of presentations if you'd like to learn more.
Thank you so much, Emily. Does anybody have any questions for Emily before we move on to the next project? All right, not seeing any in the chat at the moment, so but feel free to add things in the chat as we continue to move along, and we can always bring Emily back on if you come up with a question. So thank you, Emily. So next up we have Kim Cortez, who is going to be joining us. She is the Competitive and Supported Employment Unit Supervisor, and she is going to be talking a little bit about Disability Employment Awareness Month.
Thanks, Haley. Hi, everyone. My name is Kim, and before we provide an update on one of our employment-related projects, I'm here to highlight, as Haley mentioned, National Disability Employment Awareness Month, which happens each October. So since there wasn't a webinar scheduled last month, I have the pleasure of talking to you about it today instead. And I'm grateful to have this opportunity because awareness plays a really critical role in creating employment opportunities for people with disabilities. Whenever I get a chance to talk about employment, especially to a larger audience, I like to start with the data. So nationally, for people without any type of disability, workforce participation averages 76%. And by participation, what I mean is people over the age of 16 who are either working or actively looking for work. For people with any type of disability, that rate goes down by more than half. And for people with a cognitive disability, the numbers are even lower. HICBUF is working hard to change that in Colorado We are an employment first state, which means we support full integration and community employment for all Coloradans, regardless of disability. We have a lot of projects that we're working on that support that vision, including ending subminimum wage, developing new waiver benefits to reduce barriers to employment, and expanding the buy-in program to include the developmental disabilities waiver. We're also running a pilot program related to supported employment that you'll hear more about in a minute. And while there are lots of systemic barriers and we're working very hard to change those, Disability Employment Awareness Month is important because the most significant barrier that folks face to employment is a lack of awareness, at least in my opinion. This shows up in a lot of different ways. Yes, it's absolutely employers who aren't aware of the skills that folks have to contribute or might have, assumptions or biases about people with disabilities. But it's more than that too. There's also sort of throughout our community, not enough awareness about what supports are available to people who want to pursue employment. There's still a widespread belief that you can't work and keep your benefits, or that if you do work, it needs to be minimal to maintain your benefits. And we even hear from members that they aren't always aware of what kinds of jobs are out there because they haven't been given the opportunity to explore their career interests the way someone without a disability typically would be. Luckily for everyone, raising awareness is something that we can all help with. So while I hope that you'll join us in spreading the word next October, you and me and everybody else, we can all help create more opportunities for Coloradans with disabilities by keeping employment front and center of what we talk about and the work we do all year long. So with that, I'm going to pass it to Colin to share more about our supported employment pilot project.
Thanks, Kim. Can everyone hear me? Take that as a yes. Good afternoon, everyone. Thanks for spending some time with us on this snowy day. My name is Colin Laughlin. I'm the Deputy Office Director for the Office of Community Living. And before we get too far into the webinar today, I wanted to talk a little bit about our supported employment pilot here in the state of Colorado. So we could go, oh, never mind, Jen, you already did it. So our pilot is really an innovative project, not just for Colorado and what we're doing, but really nationally speaking. Typically, our job coaching benefit, much like all of our benefits in HCBS, is fee for service. And what this pilot does is actually flip that on its head a bit and allows for incentive-based payments to be made that are tied to outcomes rather than just hours of service in which that service is actually provided. So the goal is really to encourage strategically reducing job coaching and those supports over time. And what we're looking to do is gather some data around this, really study what the impact of this is, hoping that this will ultimately lead to more lasting and meaningful employment. Go to the next slide, please, Jen. So here in Colorado, we have 5 providers that are participating in the pilot. And again, rather than being paid for each unit of job coaching, they're paid based on each hour a participant in the pilot is working. This incentivizes providers to actually provide the minimum level of support necessary to sustain the job, meaning once they're able to fade that out, you can look at best practices with that job coaching and kind of more strategically supporting that person through their work and what that looks like to engage with a place of work. And so at the end of the pilot, which will be through March of 2024, we'll use that data to determine how we can continue these incentive-based payments, if that is the opportunity there, and how we can incorporate some of these facets and some of the knowledge that we learned from this work into broader services within the waivers. So really cool opportunity. And again, sort of aligns with what Kim had talked about here in Colorado, being both an employment first state, but I think really taking innovative steps to try to ensure that people have that integration into the community and can find lasting and meaningful employment. With that, I am going to turn it over to Mark to talk a little bit more about ACC Phase 3, and I'll see you in a bit.
Hello, everyone. My name is Mark Corello. I am the Accountable Care Collaborative Planning and Implementation Section Manager. I worked on the design and implementation of the ACC, the Regional Accountable Entities, that started in 2018, and we are beginning work on the next iteration of our program. Just to make sure that everyone is clear about what we're talking about, when we reference the Accountable Care Collaborative, we are talking about the delivery system sort of managed by our regional accountable entities, or our RAEs. So all full benefit Medicaid members who are not enrolled in a program for all-inclusive care for the elderly are enrolled into the Accountable Care Collaborative. And the RAEs work to promote members' behavioral and physical health. And they do that by supporting a network of primary care providers to serve as members' focal point of care, that medical home, and provide support coordinating services for those members. And the RAEs also administer the department's capitated behavioral health benefit. So they pay providers and do utilization management for all, or for the majority of the Medicaid covered behavioral health services. So the contract started in 2018 and they will end on June 30th of 2025. So we are beginning the work now to design the next iteration of the program and to begin work on designing the request for proposal, which will be the contract for the new vendors that will go live on July 1 of 2025. So this week we are starting our stakeholder engagement around this program. And we will be talking with stakeholders. We have a number of work groups internally that will be engaging with stakeholders as well. That will result in a series of concept briefs that will be topic specific. And those will start coming out around March of 2023. Through that engagement and getting feedback on those concept papers, we will design a draft request for proposal that we will post for public comment and conduct a number of stakeholder engagement around that to sort of refine what it is we are asking our regional accountable entities to do and ensure that that is serving the needs of the state. We will revise that request for proposal and finalize it for an April 2024 posting for vendors to submit proposals. We then hope to award the vendors in September of 2024. That will allow a 9-month transition period from our current vendors to to the new vendors, all going live on July 1 of 2025. So that is sort of a high-level timeline. We will be engaging with stakeholders throughout this work. We have contracted with Colorado Health Institute to support our external stakeholder activities. And they are working on a number of activities now and scheduling things right now. So next slide, please. So today, I really just want to provide sort of a high level and really direct people to our ACC Phase 3 webpage that I will put into the chat right now, which has a more detailed fact sheet about the information I'm presenting today. But that's where we'll also be really sharing any updates, announce upcoming meetings, things like that that are happening. So the goals for ACC Phase 3 are really aligned with the department's mission. It's around improving quality care for members, closing health disparities, improving care access, improving that member and provider experience, and then also managing costs so that we can protect member coverage, benefits, and provider reimbursements. Next slide, please. And so specifically, some areas that we have prioritized and the opportunities that we see to make significant changes to help achieve those objectives are in these 8 areas. We really are focused on improving member communication and support. We know that there's lots of confusion out there. We have a variety of different vendors that communicate on different things. So how can we streamline that communication experience and support members in understanding what benefits they have available and then how to access them more efficiently and easily? We also are focused on working with our providers and our regional accountable entities to hold them accountable for promoting equity and quality in the delivery of services. An important part of the program will really be enhancing the focus of the regional accountable entities and our provider networks on supporting referrals to community partners to address health-related social needs, such as housing, supportive services, food access, things like that we know are essential to members' health care and support their well-being. So how can we promote that more effectively as part of ACC Phase 3? The department has already begun a lot of work on alternative payment methodologies and supporting value-based payment arrangements. This is currently happening with primary care, there's maternity bundles, and so the department wants to continue to work on those and evolve those, as well as identify potential new opportunities to continue to shift towards that value-based arrangements with our providers. Care coordination is critical to the Accountable Care Collaborative, but we also know there's lots of confusion, particularly when we think of the case management agencies, and that a number of our members aren't sure who to work with for what, or members may have multiple care coordinators or people helping them access services. So we really want to work and leverage current ARPA funding that we do have for this to help better define what we mean by care coordination, case management, and identify and clarify the roles and responsibilities of the case management agencies versus the regional accountable entities, and develop the infrastructure and supports and processes and procedures to ensure better collaboration, coordination, and transfer of information, so that for the member it becomes much more seamless and they are not being pulled in multiple directions or trying to figure out how to get the necessary care that they want. We also know that children and youth have unique needs, and we want to better serve them and provide better access to services, particularly for those children with complex medical needs and that are involved in multiple systems, such as children in the child welfare system or who are involved in criminal justice. And then behavioral health transformation, there is a lot of work going on in that area with the establishment of the Behavioral Health Administration. So we want to align our work with them, support the work that's going on there, and continue to identify where there are gaps in our existing system of community-based behavioral health care, and continue to try and fill those gaps and provide better care to our members. And then last but not least is how do we more effectively leverage technology to support members and our providers and our regional accountable entities, and really improve that sharing of data so that providers and our regional accountable entities can respond more quickly and effectively when there are incidents, such as a member coming out and being discharged from a hospital. How can they really wrap around those services more quickly to support better outcomes and better member experience? As I said, there's lots more there's some more information. We are just beginning these conversations, and we're starting off with sort of this high level. And over the next couple months, we'll be sort of deepening the work that we do on each of these and identifying what are the priorities, how can, what are stakeholders' thoughts about what we should and can be doing around these different initiatives. And that will inform our concept briefs and our ultimate requests for proposals and draft requests for proposals. So please check out the website if you are interested in more information and sign up for the newsletter, and we will keep you informed. Thank you very much. I will now pass it on to Amanda Lofgren.
Great. Thanks, Mark. Good afternoon, everyone. I hope you're enjoying the snow and staying safe and warm. It's really great to follow Mark. Our teams have been working really closely because, we are working really hard in the Office of Community Living on case management redesign and a lot of work to really streamline and simplify our programs and services. And so the work that his team is doing around the affordable care and really making sure that we leverage these two extraordinary opportunities to really address some of the challenges that we know are out there today. So really by collaborating and coordinating, and as Mark said, defining roles and responsibilities and departments' expectations, so that we can increase the cross-agency coordination, reduce gaps in medical care and coordination of services. And I think Mark said it best, but really making sure that individuals aren't having to figure out who, when, where they need to go to navigate services and programs, but really that coordination is happening behind the scenes between the various coordination entities. And really just making sure that there's clear understanding between members and providers around those roles and responsibilities, so that we can reduce the duplication of services. At the end of the day, our number one goal is so that we can improve members' experience and that they're getting the services and outcomes that they need. If we go to the next slide, in order to do this and kind of thread the two programs and extraordinary work that we have in front of us, we've been able to use the ARPA resources to hire a dedicated coordinator under Mark's team. Her name's Lauren, and she joins us with extraordinary experience, and she'll be working very closely with my team, particularly Kidron and her staff, as we hire a contractor to help really work through and identify those roles and responsibilities, do member mapping to make sure that we're understanding from a member's perspective what this looks like and what this means, as well as leading a group of different stakeholder engagement activities in the future, knowing that there's a lot of work happening and wanting to be really thoughtful and intentional in how we build upon this work. So if we go to the next slide, I also have a few updates that are exciting work underway with the case management team and program through the ARPA projects. And so we, through case management redesign, one of the things that's really important is making sure that we really understand, as we move towards the changes of having a single case management agency in each of the service areas, providing supports to all members, regardless of what waiver program they're on, we have to change the way we pay for services in those programs. And so we hired Myers and Stoffers to first do a time study, and our existing case management agencies were really gracious in providing us significant amount of information that we were then able to take and do an analysis and to really look at what time is being spent on all of the different activities and tasks that we're asking today, so that we can then look at, how we will pay for it in the future, knowing that we need to move away from population-based case management. So part of that, Myers and Stoffers has provided the department with recommendations for the future rate methodology. And there are 6 recommendations. The first one, the department currently has a rural travel add-on for our case managers, but we also need to consider an urban area. In the rural areas, we know it's distance, but in the urban areas, we also know there's a lot of congestion on our roads, and that is also time. So the second recommendation that they had is really having some standards around caseload sizes. And so the department is really proposing to have standards around 1 to 65 as a maximum caseload, so that we can really ensure that case managers will have the time to work with individuals and meet their needs a lot more effectively and timely. We've also heard, and Myers and Stoffers recommended that really putting a focus on training to ensure that there's consistency across all of the case managers across the state, that it's more interactive and engaging, but also looking at, the competency testing and ensuring that people are really understanding the information. And so the department wholeheartedly agrees with that. And is working on a learning management system that will be available for our case managers. The next one is a reoccurring rate review. And so that, we're doing this work right now to review and analyze the rates, but really making sure that we're doing that on a more regular cadence, because there's wanting to make sure that we're just really looking at all of the different components that go into it and can adjust as needed. The other piece is that they recommended for us is to really look at the scope and align the rates across the populations. And so this aligns really well with the policy and the changes we are trying to achieve with case management redesign by not having rates tied to particular populations or waiver programs, and that it truly will be for case management activities regardless of the programs. And then the last recommendation that they had was for us to really look and be conscientious of, quality measures and how we pay based on quality. And so we are in the finalization of the report, and we'll be posting that to our website soon so that everyone can see what those 6 recommendations are. In addition to the work, we have also requested a budget ask for case management redesign. So over the last 5 years, we've worked really hard to increase our funding for case management agencies. And we've done that over the last 5 years by infusing an additional 25% through targeted increases. 15 million of that was permanent case management rate increases and another 4 million in temporary initiatives. But we know that we need to achieve all of our case management redesign goals, we'll need some additional funding. So we've requested 7.8 million, which is 8% of our total case management appropriation, which is a huge investment in case management to really ensure that that quality outcome is able to be met, as well as addressing if we have a standard caseload size, we need to make sure that we're able to pay for that. So in addition to the work around the rates, we also really want to focus on recruitment and retention of our case managers. They're a vital part of our programs, and we need to be able to retain them, especially as we're navigating a lot of changes. So we've been working on both short-term and long-term strategies. And the first, and it's actually open right now, but really hearing from case managers directly and doing a satisfaction survey that we built upon listening sessions and other surveys from case managers that they've reported to the department, so that this can inform future recruitment and retention strategies. The second piece that we have is at the end of this calendar year, we will be doing targeted retention payments for our case management staff across the state, which we're really excited about to be able to really acknowledge and recognize the extraordinary role that they play. So with that, Haley, I'll turn it back over to you.
Thank you so much, Amanda, and Mark and Colin, Kim, Emily, everybody for talking through these really important projects. So much going on, and I know it's a lot to listen and try to take in, but there's just so much exciting work happening, and we want to be sure that you all are aware and have an opportunity to plug in. So next slide. Yep, thank you. So we will see if there are any questions. So I haven't seen any come through in the chat, but if you have any, I offer to have you type those into the chat now, or if you prefer, you're welcome to raise your hand and we can hear your question live. So I'll give you a minute to type your question or raise your hand. All right, looks like we've got a quiet bunch today. Must be the end of the week and the cold weather. I don't blame you. So we'll just keep moving. Next on our agenda, we want to talk about some grant opportunities. So we know that obviously this is of interest to many of you. We have a number of grants that are going out to our providers, to workers, to community-based organizations, and we want to ensure that you are aware of all of them and know about these opportunities. Next slide, please. Before we get into the particular grants that we're going to highlight today, I just wanted to give you a sense of where we are in terms of our grants. So to date, we have had 6 grant initiatives that have opened their request for application or RFA process and have since closed. Awardees have been selected and contracting is currently in process for approximately 29 grantees. So that work is underway. Many of these grantees have been notified, and we're working on those grant agreements and hope to make some announcements about awardees soon. 2 of those grant teams are still reviewing applications and anticipate making awards soon. So we'll still have even more grantees to announce. We have an additional 2 requests for applications that are open right now. Those are the ones that you're going to hear about very shortly. So we want to ensure that you have ample opportunity to apply for those. And across these 8 grant programs, there's a total of about $65.5 million in grant funds that will be distributed out to the community. So we are just thrilled to finally get these off the ground. We thank you for your patience. All of our project teams have been working hard to really craft thoughtful applications and grant guidelines. And so we are so excited to be able to finally be opening these and be making awards and get that money out into the community. And in the event that you haven't seen a grant that was quite the right fit yet, don't worry. We still have 8 requests for application that should be coming in just the next couple of months. So be sure to keep an eye on our grant opportunity page on the ARPA website. That's where we post all of those open opportunities. We also will always post those in our monthly newsletter. So be sure to take a look at that when it's sent out, because all of those notifications will be in there as well. Next slide. I also just wanted to remind everyone, we've spoken about our grant financial vendor in the past, but I don't think we had a name yet. So we have selected PCG to be our grant financial vendor. PCG, so a little bit about their role, they will be actually creating the grant agreement documentation. So those contracts that our grantees will be signing, those will actually be created by PCG, and they'll really be facilitating that process. They'll be managing those agreements, and they'll also be making payments to grantees. So if you end up being an awardee or grantee, you really will be working closely with PCG around submitting invoices and being paid, as well as really managing those deliverables along the way. So again, in terms of what does that mean for you if you are a grantee, you will be working with PCG to make sure that your grant agreement gets executed, that you're submitting those invoices. They'll be available for technical assistance, and then any other reporting requirements will go through them. But that doesn't mean that HICPF won't be involved. Our project teams and subject matter experts will be working alongside PCG, and will be great contacts for you as well. But just wanted to be sure that you knew about PCG's role if you end up being one of our awardees. Next slide. All right, well, I'm excited to hand it over to Amanda Smith, who is from the Office of eHealth Innovation, and she's going to talk about one of our currently open RFAs, the Dollars to Digitize program.
Great, thank you, Haley, and hello, everyone. As mentioned, I'm Amanda Smith, and I'm the project lead of the ARPA 606 Dollars to Digitize grant program. This is really exciting. This is $18 million available to Health First Colorado enrolled HCBS and behavioral health providers. And this is to invest in adopting or enhancing your organization's digital technology and electronic health records. And since this is a grant, there is no payback required. This is a grant and an investment in technology and digital tools to support your organizations. The total investment, as mentioned, is $18 million, but each organization is eligible up to $500,000. Next slide, please. All right, I want to dive in a little bit more on the eligibility criteria in the application. So first, who's eligible? Well, first we have home and community-based service, HCBS providers, who are serving 2 or more Health First Colorado members within the past 12 months. Also eligible are behavioral health providers, regardless of whether or not they're also serving members on a waiver. And for behavioral health, providers must be serving 30 or more Health First Colorado members within the past 12 months. So if you're a provider and you're eligible and you're interested, how do you apply? Well, step 1 is we will ask you to complete the intent to apply form, which is a 20-minute initial eligibility screener to determine your eligibility and to submit some required documentation. Now that opened on October 3rd, but as you'll notice on the slide here, it closes on November 18th, which is tomorrow. So for those of you who are interested and haven't applied yet, please go ahead and submit this 20-minute intent to apply form. You'll see a link in the chat as well as here in the slides. It takes you 20 minutes or so, and you'll be able to know if you're eligible or not. So what happens if you are eligible? Well, you'll receive an email from us with a link to take the full application, which is due Friday, January 6th at 5 p.m. We've already sent out emails to those who already submitted intent to apply forms to let them know that they're eligible. And we've also reached out to some folks who we didn't quite see the data in our records, and we've reached out to gather more information, or in some cases, they were not eligible. So go ahead and submit your intent to apply. If you're eligible, you'll hear from us, and you'll have till January 6th of 2023 to submit your full application to us. Also on the screen, you'll notice that there is a link to our website. And if you're interested in this grant opportunity, we'd highly encourage you to check that out. We have all these links that were mentioned, detailed grant program guidelines for you, as well as some other resources and FAQs that you can review before applying. Next slide, please. All right, and I just want to quickly review the timeline for 606. And so starting on the left with the light blue, we have round one, which is where we're currently at in the RFA process. This is gathering the intent to apply forms. Again, it closes tomorrow, November the 18th. Next, we'll be transitioning into the application and awarding phase there in pink. And this is for the first RFA round. We will also be having a second RFA round in the summer of 2023. So starting in December and January, we will start collecting all of the applications, and then reviews will occur in mid to late January, and we're hopeful to get award letters out between February and April. Then we'll transition to the summer RFA period, in which we will be including the case management agencies who were previously not eligible for the fall RFA, but they will be prioritized for the summer. And we expect that to roll out in the May-June timeframe. After that, somewhere between July and August, we'll be reviewing applications, and we anticipate award letters going out sometime through September, November of 2023 for the fall RFA period, which includes CMAs. And with that, I'll hand it off to Colin Laughlin to talk about our training grant opportunities.
Thanks, Amanda. Go to the next slide, please, Jen. All right, I have the pleasure of talking about the training fund here this afternoon. As I think many of you had probably heard over the last couple webinars, really trying to make people aware of this opportunity. It really is a fantastic chance for your organization to get some additional dollars to help your direct care workers enhance their skill set, maybe start working within a new service, and really learn things outside of that baseline training they may be receiving. So with that, we actually have two different types of training fund grants. The first, if we could go to the next slide, please. The first is for our providers, and between the two different types of training fund grants, individual and provider, we have over 9.5 million to be precise. Up to $100,000 for providers. And who is eligible is similar to Amanda's list, is our HCBS providers or our training providers that would look for working specifically with our long-term care, direct care workforce members or individuals. And so the training grant actually opened back on the 1st of October. And the first awards of potentially 6 different cycles of grant awards will be announced on December 15th. And we're really looking for creativity, flexibility, innovation around training individuals within that provider arena. Could you go to the next slide, please, Jen? The individual grants, as I had mentioned, are 9.5 million as part of that total training fund. Get up to $500 for an individual that would allow them to, again, advance the skill set, work on potentially getting a new service type that they could potentially work for, doing some career latticing, look at career advancement, or even working with a new disability type. Who is eligible? Individuals age 18 or older who are working within our HCBS waivers, or again, people who are potentially interested in working within our HCBS waivers. So how do you apply for these grants, and sort of wrap up the grant conversation here? If we can go to the next slide, please, Jen. If you are an organization, please check the Secretary of State website to ensure you are registered and in good standing. We also strongly recommend you bookmark our ARPA grant opportunity webpage to ensure that you're getting all of those opportunities as they come through. And then certainly last but not least, please subscribe to our ARPA Project Pulse newsletter that comes out each month. In addition to having those grant opportunities, it also speaks to a lot of the different projects that have already moved forward, kind of broad updates on ARPA, some really cool deeper dives on some of the programmatic changes that we're hoping to make, and then gives you updates overall on sort of the state of ARPA and a lot of things that I think many of you will find interesting here within the long-term care industry in Colorado. So with that, I will actually go to the next slide, please, Jen. Get a couple questions here. Leah Spielberg, hi Leah, good to see your name, had a question. Do you have a sense of the average award size, although the max ask is for 500K? I believe this was for the Dollars to Digitize grants that Amanda had talked about. And I see that she had offered back. They do not have enough information yet to know exactly what that award size will be quite yet, but something that we can start to analyze once we get to and through tomorrow. Marie had asked, can you apply for more than one grant, or once you apply for one, are you done? Amanda, or maybe Haley, my understanding, and please interrupt if I'm incorrect, is you can apply for multiple grants in different areas. Obviously, within certain grant opportunities, if you submit multiple requests for grants, they're less likely to be seen or heard. But I don't know, Haley, can you confirm that approach?
Yeah, thanks, Colin. That's exactly right. You can apply for multiple grants. They just need to be for different activities. The other thing I just wanted to note, and it was on the last slide, is just a reminder that these funds cannot supplant current funding. So it has to supplement. You really, just when you're thinking about designing your grant program, these need to be new activities on top of work that you're already doing. So, but yes, we encourage you to apply for any grant opportunity that you think might be a good fit for your organization.
Thanks, Haley. And yes, I am sorry that I'd skipped that last bullet there. These funds specifically across all of ARPA grant opportunities, these funds are to supplement your work, not supplant. So we'd ask that, again, you look at flexibility, creativity, innovation in areas that you maybe are already focusing on, and looking to sort of expand, not necessarily start something from scratch or entirely new. So with that, I'll actually go to other office updates, unless there's any other questions, any live questions or hands up. I don't see any. So Jen, we'll go to the other office updates if we can. Keep rolling through that. So there has recently been a lot, I think, publicly around the public health emergency, and so wanted to provide some updates. Recently, actually, that weekend prior, we had sort of given CMS's guidance, expected to hear if they were ending the PHE. They had told us, then committed to us, that they would give 60 days to states around the public health emergency ending. And since we did not hear, that means the public health emergency will continue on for that period beyond the current end date, or what was previously the current end date in January. So it will go until at least April 11th of 2023. The next date in which we would anticipate being told anything from CMS will be February 10th of 2023. That's the 2-month notice date in which that we would be learning a little bit more from our federal partners. At this point in time, we expect to hear that, but things may change, so we'll keep you all informed, and I'll give you an opportunity to sign up for additional information here in a couple slides. Go to the next one, please, Jen. Okay, so to add another layer to all of this, the Senate voted on Tuesday to end the COVID-19 emergency declaration. Now, the declaration is different from the public health emergency, or the PHE, as we refer to it as. Only the Department of Health and Human Services, or the umbrella agency over the Centers for Medicare and Medicaid, is able to end the public health emergency. And so that vote has no impact on Medicaid-related issues or coverages tied to that public health emergency. What that does impact is things that many of us have been familiar with over the last 2+ years, 2.5 years: the student loan payment freeze, domestic agenda items like closing of ports of entry, and various customs deadlines. And so while that may have changed, it does not have a direct impact. And I know that there was admittedly some confusion all over the place because of how close those things are in sort of its origination, and hearing that they've ended the emergency declaration. Anytime you hear emergency, people sort of think it may have to do with the PHE, and in this case it does not. And we'll keep you updated around all things PHE. So to that end, if we could go to the next slide, please, Jen. We have a couple great opportunities to engage, and a website that I would strongly encourage you to share with your networks, to share with the people you serve, so they're aware of what's going on. The first piece is there's a PHE Unwind website that you're able to look through. We have toolkits for people to access that go through sort of what you should be aware of with the end of the public health emergency, both for providers, members, and then eligibility workers. That's really helpful in understanding what may need to be done yet to ensure that people remain eligible beyond that. And then if they are losing eligibility, what resources may be available to them. So would strongly encourage you to share that website with your networks. And then there's actually going to be public webinars starting today. So that first webinar started today, then we're having another one in January, again in April through July, October. And that will be really helpful for people to ask questions in real time, ask specific sort of scenario-based questions, and people can get answers to. So those, both the webinar itself and the information from the website are going to be invaluable for people who are maybe having some changes due to the ending of the public health emergency. We go to the next slide. And then here, just with that information, that's where you would access that on the website. That right-hand column, to stay up to date. You can get subscribed to those bulletins. Make sure you're experiencing those webinars, or able to experience those webinars rather. So please share with your networks. Please make sure this goes out far and wide. It really is going to, I think, help lessen some of the issues that may be experienced around the end of the public health emergency. So with that, on a brighter note, I would say, on December 3rd, we have the International Day of Persons with Disabilities. And this is a great opportunity, and we have a link to the UN there at the bottom, a great opportunity to learn more nationally, or internationally rather, about what many other countries are doing, and then what many other countries, people with disabilities, experience on a daily basis. It's, I think, very eye-opening, and a lot of good information there. So please, we would ask you to share this information as well, and also recognize and observe the International Day of Persons with Disabilities on the 3rd of December. With that, I will open it up to any questions. I see that Amanda Jackson had already responded. So any questions in real time? Okay. Well, I will move us along then. If we could go to the next slide, please, Jen. As always, please, 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 for the sake of Jen and Max and everyone else who are so helpful in setting these up, Haley, please take our 1-minute survey. It is truly 1 minute. I'm not being hyperbolic there. Please, if you take that, it's really helpful in helping us put together structures and what people want to hear. So there's an opportunity to directly engage there. We can go to the next slide. So we are planning our general update webinars and ARPA webinars for 2023 now. We do not have any webinars in December of this year. We do, however, have lots of ways that you can still hear our voices, in particular, probably Bonnie Silva's. We have the JVC hearing on the 21st of December. Prior to that, we also have several briefings that are spread out starting actually a couple days ago through mid-December. So a lot going on still, but would also encourage you all to take a deep breath, spend some time with your families, rest and recharge for what I imagine will be a very busy legislative session and a lot of conversations, worthwhile conversations about how we can help improve the long-term care system in Colorado. So keep an eye out for that. And then please also take an opportunity to provide feedback or suggestions for things that you want to see and hear and have us present on for next year. And with that, I'd like to thank you all for spending some time with us on this snowy, dreary Thursday afternoon. And I hope everyone has a very safe holiday season. And we'll see you in the new year. Thanks all.